Hi everyone, today we are here with my patient and we are going to be doing some trigger point therapy. So prior to filming this video, we of course went through and did a full Team J assessment and we assessed each muscle that we're going to be treating today, and we identified some trigger points in her trapezius bilaterally. So going in here, I have my lidocaine drawn up. We do about 0.5 ml of lidocaine per trigger point identified. So since we're only treating one here on each side, I have 0.5 of lidocaine drawn up into my 3 ml syringe, as well as my neurotoxin in that syringe as well. So starting off, you really want to make sure you're isolating up that muscle and knowing where your needle is. Before I went in and started injecting product, I made sure to give a good aspiration. And then I just pushed a little bit of lidocaine just to start getting her numb. And then I started going in and breaking up that trigger point. As you can see, it's a little bit hard to tell in the video, but as I started, it was a little bit harder for me to get that needle in there because I was going through that dense muscle fibers. So as we go here and as I treat the trigger point, it's getting smoother and smoother. It almost feels like you're sticking your needle into styrofoam if you find a true trigger point. And we're going to go ahead and do the same thing on the other side. We're just cleaning her really, really well with an alcohol wipe. And then we're going to go ahead and isolate that muscle up again on this side. You can have up to 3 trigger points per trapezius. For her, like I said, we are only treating one, and then we will see her back in 2 weeks and see how she is feeling and if we need to do any follow-up treatment. But again, I'm going in here and giving a good aspiration, pushing a little bit of lidocaine to start getting her numb and just hopefully make her a little bit more comfortable as we go in and start breaking up those muscle fibers. As you can see, as I'm treating, I'm not going any farther than about half needle depth. In this area, we do want to be aware that the lung is close by. In any area that we're treating, we want to make sure we're aware of surrounding anatomy, but especially in this case, you can cause a pneumothorax. It's very rare if you're using safe injection technique, but it is possible, especially if you're treating a very petite patient. So just always be aware of where the tip of your needle is and be isolating that muscle up. Now we're just going to go ahead and start moving our way up the head and neck. So here I'm going to go ahead and mark my splenius capitis. We are also going to be treating her masseters today and her temporalis. Here we are up in her hairline, so it's a little bit difficult to clean, but I'm trying to get her as clean as possible, especially in a female. The hair is going to be there, so I'm just wiping as good as I can. Before going in and marking where I want to treat. I kind of find the back of that mastoid process and move my thumb down and find that little groove. And that is right where we're going to go for our splenius capitis. Here for masseters to mark up, I go ahead and find my lateral borders first. And I'm just marking those. And then I like to go about 1 centimeter above the mandible. Can be different from patient to patient, but I like to find the bulk of that muscle and treat there. Some patients I will do 2 entry points, but for her we just ended up doing 1. So I'm going to go ahead and do the same exact thing on the other side. So I'm just cleaning her up really, really well. We already had her remove her makeup and everything like that. Again, just finding my borders of that masseter and then finding the bulk of that muscle where I want to focus my product. Like I said, she is a chronic clencher and grinder, so this is a really, really amazing treatment for her. So now we're just going to go ahead and start treatment. Like I said, we were only doing trigger point therapy today in her traps. So for everything else, we're just going in with our ComfortTox syringes. In the splenius capitis, I do go ahead and give a little aspiration, even in my small ComfortTox syringe, just to ensure I'm not in any vessels, and then just going ahead and placing that product. Same thing on the other side, find my placement, go in, aspirate, and give. Masseters, I always like to double check, find the bulk of that muscle, and I like to go a little bit posterior just to ensure that we're avoiding that risorius. I don't want to affect her smile at all. And we're going to go ahead and do the same thing on the other side. Find the bulk of that muscle. And I'm just going right behind my dot there and going ahead and injecting. For her temporalis, I don't mark anything out because we are going up in her hair. Again, I'm cleaning as good as I possibly can and just holding that hair up out of the way. For her, I did 2 injection points. I like to have my patient point out to me where they experience most of their pain when they do have a headache. And hers is kind of right up there in front of her, like right above her forehead there in the front of her temporalis. So I focused some product there, and then I did a second entry point just posterior to that. And we're going to go ahead and do the same thing on the other side. I have her clenched down so I can find that muscle and really feel where it's the strongest. And 9 times out of 10, that's going to correlate to right where they're telling you that they're having the most of their pain when they do have a headache. So I'm going ahead and just cleaning that really, really well and just having her clench, find where I want to inject, and go ahead and do the same 2 points here on the other side. Like I said, we will see her back in 2 weeks and ensure that, she's had pain relief, and if we need to do any enhancements in any area, we will do that at that time.